Good evening, my beloved people. It's my sincere hope that you are doing well wherever you are. It's Ishmael Mbithi again. I'm here on behalf of MIVHT, MTUMISHI Ishmael Volunteer Health Talks. I am here to discuss a very important topic that many of you have requested me to discuss. It's very interesting and I'm sure that you are going to like it. Before we continue, if you are new to this channel, kindly make a point of subscribing and also click on the notification bell so that whenever we upload something, you can be notified. Now, journey with me as I unfold the mystery of pelvic inflammatory disease. Now, what is this pelvic inflammatory disease? Pelvic inflammatory disease is one of the gynecological disorders. Gynecological disorders, I mean, one of the disorders that affect female. The females experience these pelvic disorders, and I thought it is wise to discuss this pelvic inflammatory disease because it's very common. Now, pelvic inflammatory disease, pelvic, I've said, includes the parts of the reproductive system. It's basically the reproductive system of a female: vagina, the cervix, the uterus, the oviduct, the tubes, and the ovaries. So this pelvic inflammatory disease can occur at any of those organs. It can occur at the cervix. So if that inflammation occurs at the cervix, it is called cervicitis. If that inflammation occurs at the uterus, it is called endometritis because the lining of the uterus is called endometrium, and therefore the name endometritis. And if the inflammation occurs at the fallopian tubes, it's called salpingitis. So these are some of the forms of PID. I've said pelvic inflammatory disease can occur at either any of those organs: cervix, uterus, the tubes, the fallopian tubes. Now, what is the cause of this PID, pelvic inflammatory disease? PID, before I continue, I have to mention that it is sexually transmitted. Note it somewhere. It is sexually transmitted. And if it is sexually transmitted, it means that the bacteria, it is caused by bacteria. So it means the bacteria that cause PID are sexually transmitted. And in most cases, men are the carriers. Yes, men are the carriers. So what are some of the bacteria that can cause PID? We can have gonorrhea, we can have chlamydia, we can have trichomonas, we can have treponema, we can have E. coli, etc., etc. Number two, what can cause PID is menses. Menses is the blood, the menstruation. How does menstruation cause PID? Your menses are alkaline, and the environment in a woman's vagina is acidic. So when a woman is menstruating, the menses neutralize the acidity of the vagina, and this provides a very good environment for bacteria to thrive. And therefore, the bacteria can get an opportunity to ascend from the vagina to the cervix, to the uterus, to the tubes, and they can cause inflammation of those organs. I have to mention that we have good bacteria that are present in the vagina, and we have bad bacteria. So when the menses come descend to the vagina, they neutralize the environment, and this provides a good environment for bacteria to thrive. I have discussed the cause. Now, I just want to mention something here, that PID will have vaginal discharge. And again, we also have other infections that can cause vaginal discharge. We have UTIs, UTI is urinary tract infection. This is an infection that affects the bladder, the ureter, and the urethra. So that is UTI. UTI will also have some discharge. We also have vaginitis. Vaginitis is an infection that is mostly caused by trichomonas or chlamydia. And therefore, vaginitis will have some discharge, but this discharge will be yogurt-like. Yeah, you know the color of yogurt, how yogurt looks like. So a discharge from vaginitis will be like yogurt, and the walls of the vagina will be red. That is vaginitis. So we have two characteristics here. Vaginitis will have yogurt-like discharge, and the walls of the vagina will be red. So why did I mention UTI and vaginitis? It's because PID, which I'm discussing today, also has some discharge. So the difference here is the discharge from PID will be of any color, but on vaginal examination, what we call the VE, vaginal examination, the client, or rather the patient, will feel some pain and discomfort. In vaginitis, on VE, there is no pain, there is no discomfort. But in PID, the patient will feel some pain and discomfort. So you should use that as the differential diagnosis. Now, I have discussed the cause. I just want to look at the risk factors. What are some of the things that can predispose you to PID, pelvic inflammatory disease? Or rather, what are some of the factors that can increase your chances of contracting PID? One, as I said, PID is sexually transmitted. So having unprotected sex predisposes you to PID. Number two, having multiple partners. We said men are the carriers of this bacteria. So if you have sex with various men, the chances of contracting PID are very high. Number three, if you have a partner who is having sexual intercourse with many other partners, it also increases your chances of contracting PID. The other thing is douching. What is douching? Douching is whereby a female washes the inside of a vagina with fluids and strong soaps. Those things are very dangerous because they disrupt the normal balance between the bad and the good bacteria in the vagina, and this can give bacteria an opportunity to thrive and cause PID. So douching is also a risk factor. The other thing is about a family history of PID predisposes you. If your relative, your mother, your sister has ever had this PID, you are also at a risk of getting it. The other risk factor could be some surgical procedures like cervical biopsy. The instruments that are used can introduce some bacteria in your system and cause these PID. Lastly, but not the least, we can have STIs. If you have an STI, for instance, gonorrhea. Remember we said one of the bacteria that cause PID is gonorrhea. So the bacteria that causes gonorrhea, if it is present now, the chances of having PID are very high. So that is basically some of the risk factors. We may have many others, but that is some of them. I want to look at the clinical manifestations. The clinical manifestations is the signs and symptoms, or rather, how would you know that this person has PID? How would you know that this client has pelvic inflammatory disease? So since it is an infection, where there is an infection, there should be fever. So fever is elevated body temperature of above 38 degrees Celsius. So there will be some fever and chills, general body weakness. But now there are the main symptoms. One, where there is inflammation. One of the cardinal signs of inflammation is pain. So the pain can be in your pelvic brim, the pelvic region. You can also have some pain, lower abdominal pain, just below your abdomen here. That is pain. Now, what about your menses? What about your periods? Does PID affect your periods? Yes. How does it affect your periods? It can lead to delayed periods. Your periods can delay. Your periods can become irregular. Yes, irregular periods, delayed periods, prolonged bleeding. Prolonged bleeding is if you menstruate for like 3 days, it can prolong to up to 7 days, 8 days, 9 days, etc. So prolonged bleeding. And lastly, you can have heavier bleeding, very heavy bleeding. So PID has the potential of affecting your menses. That is about your periods. What about, we say there is pain. So pain will occur to other things, like when you are urinating, you can have some pain. So painful urination, what we call dysuria. You experience some pain, burning sensation when you urinate. You also can experience some painful sexual intercourse, like painful sexual intercourse. Whenever you are having sexual intercourse, you feel a lot of pain. That could be an indication of an infection called PID. What about after sexual intercourse? You can experience some bleeding. You can experience some bleeding, vaginal bleeding after sex. You can also have some bleeding in between your periods. Yeah, in between your periods. So these are some of the indications, the clinical manifestations of PID. I hope you are following. Now, I want to discuss about how can you prevent this PID, pelvic inflammatory disease. I want you to think about the risk factors that I've mentioned. Like one of the risk factors is having unprotected sex. So if you want to prevent PID, make sure when you're having sexual intercourse, you use safe measures like using condoms. So that is to make sure that you are not contracting the bacteria. Number 2, avoid multiple partners. Avoid multiple partners because we said men are the carrier. So if you have sex with many partners, then the chances of getting PID are very high. Now, we also said you can be having a partner who is having sex with many other partners. So make sure that you are faithful to your partner. Make sure you are faithful to your partner. The other thing is avoid douching. Avoid douching. Avoid using strong soaps. Yeah, strong soaps and other fluids to wash the inside of your vagina. That can predispose you to this. We mentioned something about STIs. So make sure that you get regular screening for STIs. Get screened. Don't be scared. Just screen to make sure that you are safe. And lastly but not the least, you can have regular gynecological checkups. This will make sure that your general well-being is enhanced. Your health is promoted. So visit a gynecologist for just general checkup. And this will make sure that you are safe. The other thing is hydration. Hydration is drinking a lot of water. Take a lot of water. Why? Because this water will flush out the bacteria that can be in your system. Just take a lot of water. Yeah. I know we can have so many preventive measures, but those are some of them we can add on the list. Now, what about the treatment? Now, everything that as a prevention measure can have some treatment. So, treatment is basically use of antibiotics. We use antibiotics to treat pelvic inflammatory disease. And treatment, mark this, treatment is a combination of 3 antibiotics. 3 antibiotics. We can have a combination of cephalosporin. Cephalosporin can include cefexime, ciprofloxacin, and levofloxacin. You can use any of them. Cefexime, ciprofloxacin or levofloxacin. N of them are cephalosporin. You had doxycycline, which is a class of antibiotics called tetracyclines. So in the class of tetracyclines, you choose doxycycline. Now you had another antibiotic from the class of nitroimidazoles. You take metronidazole, which is flagyl. So for treatment of PID, you use 3 antibiotics, a combination of 3 antibiotics. One of them is either cefixime. You can use cefixime plus doxycycline plus flagyl, or you can use ciprofloxacin plus doxycycline plus flagyl, or you can use levofloxacin plus doxycycline plus flagyl. Now, these drugs should be taken twice a day, that is BD, for 14 days. That is 2 weeks. You take the 3 antibiotics twice a day for 14 days. The other thing you need to understand here is treatment should be done with your partner. Because, for example, if your partner has the bacteria and you get the treatment alone, when you go and have some sexual intercourse with him, then he will give you different doses of packages of these bacteria. So it's good and very necessary to get this treatment with your partner. But if you have multiple partners, bring all of them. Bring all of them. But make sure you get treatment with your partner. That's why I'm insisting that you stick and be faithful to your partner, because it makes things easier when it comes to treatment. We can't do contact tracing of all your partners. Maybe some of them have traveled far away from the country. How can you? So make sure that you come with your partner for treatment. So that is basically how we treat this. And now lastly, if this pelvic inflammatory disease is left untreated, if it is not treated, what can it do? I want to discuss about the complications. Complication number 1 is infertility. Infertility is the inability to conceive and have children. Why do you think so? It is because we said this PID can attack your tubes, can block the tubes, the fallopian tubes, the salpingitis. And when the tubes are blocked, you cannot conceive. So what should you do? You should get a test called HSG. HSG to check whether your tubes are open or your tubes are closed. From there, the physician will know what to do. There are procedures that can be done to open your tubes. So one of the complications of PID is infertility. Number 2, we also have what we call ectopic pregnancy. Ectopic pregnancy is pregnancy that grows when implantation occurs outside the uterus. Remember, uterus is where the zygote is implanted and the baby grows and all that. So if implantation occurs outside the uterus, that is ectopic pregnancy. The other complication could be abscess formation. We can have some abscess formation in the system. The other thing that PID can do is chronic pelvic pain, a lot of pain in your pelvic region, in your abdomen and all that. We have many complications, but these are some of them. I've said we can have infertility, which is very serious. Many couples don't have children because of PID infections. Please go to hospital and get screened. Number 2, we can have ectopic pregnancy, which never grows and can cause death. We can also have some abscess formation, some pus formation, fluid accumulation in your system, reproductive system. The most common is what we call the tubo-ovarian abscess. And lastly, we can have chronic pelvic pain and abdominal pain. Yeah, that is basically pelvic inflammatory disease. It's very serious, but it's treatable. It can be prevented. It can be treated. So let's take care of ourselves. This message should go to our young girls and every woman of reproductive age who is sexually active. This message is very relevant for you. So that's it. If you have a question, you can put it under the comment section. If you need clarification, put it there and we shall be well. This is courtesy of MIVHT, Mtumishi Ishmael, Volunteer Health Talks. We will be bringing talks of this kind. Thank you.